Self-concept is an individual's conceptualization of himself. Nurses need to help patients adjust to alterations in self-concept and support components to promote successful coping. Parents and primary caregivers have tremendous influence on the development of a child's self-concept. Individuals learn and internalize cultural influences on self-concept and self-esteem in childhood and adolescence. In adulthood, job satisfaction and job performance are linked to self-esteem. The sense of self is often negatively affected in older adulthood. Many factors affect self-concept. Ethnicity and cultural influences on self-concept and self-esteem exist across the lifespan. For example, for boys, a family income above poverty rate, positive family communication, and involvement with a religious community are associated with high self-esteem. For girls, being of African American or Hispanic ethnicity, having a positive family communication, and feeling safe were predictors of high self-esteem. It will be important for nurses to be knowledgeable about variables that affect self-esteem and self-concept. The family effect on self-concept development. The family plays a key role, for children develop their basic sense from family. Strong parental support and parental monitoring create positive effects, and family and cultural influences can be positive or negative. Children develop a sense of who they are from their caregivers. Additionally, a child gains from family norms for thinking, feeling, and behaving. Parents who respond in a firm, consistent, and warm manner have children who have good self-esteem and develop low-risk behaviors. Positive communication and positive social support foster self-esteem, especially in adolescence. A family who exhibits bad habits such as smoking, alcohol use, and/or drug usage may impact family members in a negative way. Development of self-concept is a lifelong process. Erikson's psychosocial theory, which you probably remember from psychology, says that each stage builds on tasks of the previous stage, and successful mastery leads to a sense of self. Each developmental stage involves factors that are important to the development of a healthy, positive self-concept. The self-concept is always changing and is based on the following: a sense of competency, perceived reactions of others to one's body, ongoing perceptions and interpretations of the thoughts and feelings of others, personal and professional relationships, academic and employment-related identity, personality characteristics that affect self-expectations, perceptions of events that have an impact on the self, mastery of prior and new experiences, and finally, ethnic, racial, and spiritual identity. Self-esteem is usually highest in childhood, drops during adolescence, rises gradually through adulthood, and declines again in old age. Erikson's stages are helpful in understanding key tasks. Be sure that you familiarize yourself with those. Components of self-concept: identity, body image, and role performance. Identity includes the sense of a person over time and in different situations. Feelings about body image include those related to sexuality, femininity, and masculinity, youthfulness, health, and strength. Body image is the mental picture of one's body and is not necessarily consistent with a person's actual body structure or physical appearance. Role performance includes roles such as parent, supervisor, or close friend. Identity is formed in childhood as children learn culturally acceptable values, behaviors, and roles through identification and modeling. Part of this identity includes gender awareness and sexual identity. Feelings about body image include those also related to sexuality, femininity, masculinity, youthfulness, health, and strength. Racial and ethnic background can influence one's ideas regarding body image. Values such as ideal body weight and shape, as well as ideas about body piercing and tattoos, youth, beauty, and Western culture's ideas regarding aging impact self-concept and self-esteem. Societal roles oftentimes impact how we perceive role performance. Having difficulty living up to perceived societal or cultural standards can affect the self-concept and self-esteem. Any real or perceived change that threatens identity, body image, or role performance can affect self-concept. Changes that occur in physical, spiritual, emotional, sexual, familial, and sociocultural health affect that. An individual's perception of the stressor is the most important factor in determining his or her response. The ability to reestablish balance following a stressor is related to numerous factors, including the number of stressors, the duration of stressors, and health status. During self-concept crises, supportive and educational resources are valuable in helping a person learn new ways of coping with and responding to stressful events or situations to maintain or enhance self-concept. Notice on the chart there are stressors affecting self-concept. These stressors can be real or perceived. They challenge a person's adaptive capabilities. Identity stressors can occur at any time during the lifespan, but particularly during adolescence. Role performance stressors can occur in relationship to situational transitions that occur when parents, children, spouses, family members, or close friends die, or when people move, marry, divorce, or change jobs. They can also occur when one moves from a place of wellness to illness. Role ambiguity involves unclear role expectations, which makes people unsure about what to do or how to do it. Role overload involves having roles or responsibilities that are unmanageable, and this can occur when a person is ill. Role conflict results when a person has to assume two or more roles that are inconsistent, contradictory, or mutually exclusive. And role strain combines role conflict and role ambiguity. Body image stressors include those that occur in appearance, structure, or function of the body part. Self-esteem stressors can vary within developmental stages. And chronic illness, injuries, or surgeries change lifestyle patterns, and this affects a person's sense of self-worth. When caring for patients, nurses need to take a personal inventory of their own feelings, expectations, and attitudes. Your nursing care significantly affects the patient's body image. Be aware that both your nonverbal and behavior and the words you use can have a direct positive or negative impact on the patient's self-perception. For some adolescents, the decline in self-esteem results in increased risk-taking behavior or unsafe behavior, such as premature sexual activity, unprotected sex, risky driving, or substance abuse. Changing physical appearance can disturb the body image. In addition, low self-esteem and stressful life events significantly predict suicidal ideations in older adolescents. Nurses in all healthcare settings need to initiate suicide screening for early detection for suicide risk and to implement nursing interventions directed towards suicide prevention. See box 33-4 on page 664 for self-concept and the impact of body image, self-esteem, and stress on the adolescent smoking behaviors. The older adult self-concept can be negatively affected in older adulthood because of the number of life changes. However, in some individuals, aging promotes improved coping strategies that protect against declining feelings of self-esteem despite the physical and emotional changes associated with aging. Nursing implications for practice in the older adult include clarifying what life changes mean and the effect on self-concept, discuss health problems, declining socioeconomic status, spousal loss or bereavement, and the loss of social support following retirement. Be alert to preoccupation with physical complaints, assess complaints thoroughly, and if no physical explanation exists, encourage older adults to verbalize their needs in a non-physical way. Identify positive and negative coping mechanisms and support effective strategies. Encourage the use of storytelling and review old photographs. Communicate that the older adult is worthwhile by actively listening to and accepting the person's feelings, being respectful, and praising healthy behavior. And allow additional time to complete tasks. Reinforce the older adult's efforts at independence. Develop an open, non-restrictive attitude for addressing and encouraging cultural practices to improve patients' contact. Ask patients what they think is important to help them feel better and gain a stronger sense of self. Encourage cultural identity by individualizing self-care practices and offering treatment choices to meet the patient's self-concept needs. And facilitate culturally sensitive health promotion activities that address at-risk behaviors identified through evidence-based practice. Racial and cultural identity are important components of a person's self-concept. Early in growth and development, an individual develops this identity within the context of family. As the individual grows, the cultural aspects of his or her self-concept are reinforced through social, family, or cultural experiences. In addition, a person's self-concept is strengthened or questioned through political, social, or cultural influences experienced in school and workplace environments. Positive or negative cultural role modeling or past experiences influence self-concept. When assessing, observe for behaviors that suggest an alteration in the patient's self-concept. Make sure to assess the patient's coping skills and resources, support from significant others, and patient expectations. Assess the patient's cultural background. Determine feelings and perceptions about body changes, self-esteem, or their role, and assess the quality of the patient's relationship. Nursing diagnosis and planning. When selecting an appropriate nursing diagnosis, use the NANDA-approved nursing diagnoses and make sure to incorporate aspects of cultural diversity. Develop an individualized plan of care for each nursing diagnosis. Work collaboratively with the patient to set realistic expectations for care. The care plan presents the goals, expected outcomes, and interventions for a patient with an alteration in self-concept. Interventions help the patient adapt to the stressors that led to the self-concept disturbance and support and reinforce the development of coping methods. When planning care for a patient who is experiencing problems with self-concept, you will use both critical thinking and the nursing process. The perceptions of significant others are important to incorporate into the plan of care. Individuals who have experienced deficits in self-concept before the current episode of treatment have often established a system of support that includes mental health clinicians, clergy, and other community resources. Implementation. Nurses can use touch and eye contact to enhance the patient's self-esteem. Implementation needs to be targeted to the patient at the specific level of care. Consider whether implementation will occur as a health promotion, in the acute care setting, or in the restorative care setting. Work with patients to help them develop healthy lifestyle behaviors that contribute to positive self-concept. Measures that support adaptation to stress, such as proper nutrition, regular exercise within the patient's capabilities, adequate sleep and rest, and stress-reducing practices contribute to healthy self-concept. In the acute care setting, some patients experience potential threats to their self-concept because of the nature of the treatment and diagnostic procedures. Interventions designed to help a patient reach the goal of adapting to changes in self-concept or attaining a positive self-concept are based on the premise that the patient first develops insight and self-awareness regarding problems and stressors, and then acts to solve the problems and cope with the stressors. Evaluating. Evaluation is the last link in the process. This step determines whether a patient's outcomes have been met. Use critical thinking to evaluate the patient's success in meeting each goal and establish outcomes. Key indicators of patient self-concept are nonverbal behaviors. Observe the patient's nonverbal behaviors, looking for whether they indicate a positive self-concept. Ask the patient to share opinions and ideas. Note whether they include statements of self-acceptance or acceptance of change in appearance or function,